Hi, my name is Dr. Carl Sutton. I'm an orthopedic surgeon, fellowship trained in sports medicine. I do shoulder and knee replacements as well. I specialize in sports medicine. I was fellowship trained in Detroit, doing a sports medicine fellowship there, which was heavily focused on hip, knee, and shoulder. Sports medicine is really the focus on soft tissue injuries to tendons, ligaments of the body. Sports medicine is the treatment of all patients, young, old, weekend warriors, college athletes, high school athletes, or professional athletes. People with soft tissue injuries, whether they hurt it on the field or in the gym or at home, a tendon, a ligament, soft tissue injury would all be considered sports medicine. Along with sports medicine, I do have an interest in shoulder and knee replacements, which I do a fair bit of. As far as knee replacements, I recently started doing the Mako robot assisted. Some of the benefits that you can see from a Mako robot are potentially earlier range of motion, some less pain immediately after surgery, and a quicker recovery. All surgeries vary on the length of recovery and how long you are going through that recovery process. For total knees, people are up and walking an hour after surgery. Usually it's an outpatient procedure. As far as shoulder replacements, again, it's an outpatient procedure with expected recoveries around 3 to 4 months, full recovery, sometimes 6 months to a year. As far as soft tissue injuries, the recovery can sometimes be a little lengthier because you have to rely and wait until that soft tissue heals itself back to the bone. Full recovery for a rotator cuff repair or an ACL reconstruction, something along those lines, are closer to 6 months. I would probably say I'm more conservative with regards to surgery. I would almost always initiate a conservative treatment protocol before suggesting surgery unless it was in the face of a fracture or something that absolutely needed to be dealt with surgically on an urgent basis. Our recent merger with Georgia Bone & Joint and Sutton Orthopedics was a great addition to both practices. It allows us in our Stockbridge and Fayetteville locations to have access to a surgery center, has access to more ancillaries such as physical therapy and imaging, which can sometimes make scheduling a little bit easier for patients and make the whole process sometimes a little smoother. With regards to workers' compensation claims and injuries, Sutton Orthopedics has been dealing with workers' comp for decades and has a very good reputation, and we take very good care of our work comp patients. I think that's one thing that we will be able to add to Georgia Bone & Joint. I hope this information was helpful, so if I can help you in any way, I look forward to seeing you in one of our offices.
To make your appointment, visit us online at georgiaboneandjoint.org.